hardest. And our final new initiative for this year is Promoting Mental Health Through Task Sharing, presented by Rebecca Calhoun and Dr. Stephanie Thompson. Rebecca Calhoun is a public health professional and mindfulness educator at the University of Washington Center for Child and Family Well-Being, where she leads training, partnerships, research, and program development to support the well-being of parents, youth, and providers. With more than 15 years of experience teaching mindfulness, she has developed and facilitated programs for diverse communities, including trauma survivors, first responders, and incarcerated pregnant women. She previously managed the New Moms Connect study, offering mindfulness and self-compassion interventions for pregnant and postpartum women facing economic adversity. She received her Master of Public Health from the University of Washington, and she serves as faculty for the Mindful Birthing and Parenting Foundation. And Dr. Stephanie Thompson is a child psychologist and researcher at the University of Washington Center for Child and Family Well-Being, where she studies the interplay between maternal stress, parenting, and early childhood development. Her work focuses on tailoring maternal health services for mothers experiencing economic adversity, depression, anxiety, and other challenges during pregnancy and parenting. As a clinician and researcher, she explores how parental traits and child temperament interact to shape emotional and behavioral outcomes, and her most recent work investigates how targeted parenting practices can reduce stress and support infant brain development. Thank you.
All right, thank you all. I want to take a moment to start us off with gratitude, with appreciation for our organizers and the underwriters for today, especially the folks at, of course, Chad's Legacy Project, UW Psychiatry, and UW Harborview. I am Stephanie Thompson. As Bert graciously introduced me, I'm a child clinical psychologist by UW training, and I'm joined on the stage by my colleague of over 10 years at the CCFW. Some more folks around the room that are members of the CCFW family. Our director, Lily Langua, would absolutely be on the stage with us today, but she's watching her daughter walk across a graduation stage. So we're celebrating as a CCFW family that accomplishment as well. Look at this, I'm advancing the slides. Okay. The luxury of going last in this presentation is that so much of this work has been done for me. The first problem that I want to kind of bring to the spotlight is one that was referenced by Senator Dingra, and that's the issue of burnout. So we know that professionals who are working with children, with youth, with families are experiencing a tremendous number of secondary trauma, of stress, of their own mental health suffering, of burnout. And by these professionals, I'm talking about everybody in contact with children, youth, and families, ranging from early childhood educators to K-12 educators to staff working in community mental health, just to name a few. And there's been some talk about how this means that people in these contexts aren't able to uptake and provide more for the communities that they're serving. I also want to take a step back and of course highlight that the well-being of these professionals has merit in and of itself. It's a problem that we need to address in addition to the turnover and the burnout and the kind of limited effectiveness in these roles when people are suffering. The second problem that I want to center today has also been mentioned. It's the rise in mental health symptoms among children, youth, and families. We have a lot of data showing this rise in the recent years, and some recent statements from the Surgeon General also highlighting that there is a parental mental health crisis in addition to the crisis experienced by children, youth, and families. And while we have this tremendous rise in symptoms, we don't have a lot in the way of, here's another thread from today, preventative interventions, right? Stopping upstream. And again, we can think about this in the context of it's a good investment because it's going to cost systems more down the line. And we can also hold that why would we want somebody to get to the level of clinically distressing suffering when we can intervene a little bit earlier? but those preventative interventions just aren't readily accessible, particularly for underserved communities. The interventions tend not to be trauma sensitive, culturally kind of supportive and responsive. And also we know that community members tend to receive services from people that they know and people that they trust. And there aren't a lot of kind of program models that are really capitalizing on the trust and the wisdom within communities to deliver these types of preventative interventions to kind of support the mental well-being of children, youth, of families before they're really, really suffering. So to address that first problem, that problem of burnout, the CCFW, Center for Child and Wellbeing, there's a lot of acronyms, developed REAL-PRO, where REAL stands for Resilient Attitudes and Living for Professionals. This brings together the best of what we know in terms of cognitive behavioral strategies, in terms of mindfulness strategies to support professionals serving children, youth, and families. It's a relatively short intervention. We deliver it in probably 9 hours, usually 6 weeks, from 90-minute to 2-hour sessions, but we really tailor that to the constraints of the organization. It's unique in that it's interdisciplinary. So there are a lot of interventions out there supporting professionals, but oftentimes they're tailored just to medical providers or med students or home visitors. And at this point, since 2017, we've provided REAL-PRO to a variety of organizations and professionals, and they're kind of all reporting that universal applicability. We know it works. So some of the strategies and skills that are emphasized within REAL-PRO really are about equipping people to regulate their own emotions, to cope with challenging situations, and to strengthen their self-compassion. And then in our kind of empirical study of the intervention, we are seeing improved resilience, improvements in self-compassion. So we have some good evidence to suggest that this is helping people. It's about 1,500 people that we've served since 2017. We also know that participants love this programming, and I won't take the time to read every word on this slide. And I think one thing that isn't highlighted here is that professionals need this opportunity actually to come in a group context. These are group-delivered interventions, so that they have a sense of that they're not alone and isolated in their suffering. So one benefit of this intervention is that we are delivering it in the group-based setting. And now I'll allow one of our qualitative findings to speak for itself. It helped me to slow down, to be more regulated so I could help children in their regulation. It helped me be aware of my environment, my body, and what is affecting me in the moment, and process and control those emotions in a compassionate way towards myself and others. Okay. So that's a solution to address the burnout problem. We've also developed a number of preventative interventions for the second problem, the rise in mental health suffering in children, youth, and families. And I'm going to present 3 of our programs here. They differ in the target audience, the target population, across the 3 slides. So kind of going developmentally, the first program that we've developed is New Parents Connect. The NEW stands for Nurturing Emotional Well-Being. This is our program that's really designed to support new parents and their infants. It emphasizes parents' emotion regulation because obviously we need to be in control of our emotions to effectively parent. It teaches some really practical skills for some of that early attachment that Jürgen was talking about earlier today, so like the warmth and connection between parent or caregiver and child. And then also gives some like targeted strategies for parenting skills that we know are associated with promoting optimal infant development. Moving to that second box, we've developed CCAP, or Social Emotional Competence for Children and Parents. It mirrors the New Parents Connect intervention, but this time it's supporting parents with early school age or preschool age children. So not only are we thinking about ways that we can fortify parents in their emotion regulation, but we're starting to think about how can we sneak those emotion regulation skills to early children as well. We're equipping parents with just skills, strategies, kind of what best practices are for navigating the challenging behaviors that are just kind of part and parcel of this developmental period. And then also really highlighting, emphasizing, and encouraging strategies, parenting strategies that are going to be associated with more optimal child development, social, emotional, academic, etc. And then the last program that I want to highlight today is the Be Real program. So before we had Real Pro, Resilient Attitudes in Living for Professionals, this is Be Real, same acronym, but this time supporting youth and young adults. So to date, we've primarily implemented this in colleges across the nation, and now we're also looking to implement this within high schools, locally within Washington and beyond. And this program really is about promoting self-awareness, empowering youths to kind of slow down, to develop their mantras, to get a sense of their social connection within their communities, as well as to develop their emotion regulation repertoire and their coping skills. Now, these, I hope I've communicated, are like brief. They're similarly kind of 6 weeks, 90 minutes. They're practical, and while they weren't designed to be interventions for people who have clinical levels of symptoms, a lot of our participants, you won't be surprised to find out, come into our programs with clinical levels of symptoms. And the New Parents Connect intervention, for example, while it's not targeting mental health symptoms, has been shown, for example, to decrease anxiety among parents. We have done some good research looking into the effectiveness of these programs. We know that in addition to having an effect on parental anxiety, for example, that New Parents Connect is effective in improving that sensitive, responsive parenting that is bedrock to attachment. We know that CCAP is effective in promoting parental scaffolding. So one of those parenting strategies that we know kind of undergirds academic achievement as well as social and emotional competence in children, which we have data for. And then within Be Real, we do see reports of improvement in resilience and connection and self-compassion. So we have some good data to suggest that these interventions work. And that's not altogether surprising because we really looked to the research literature out there, right? We're drawing from psychology research, from mindfulness research, from developmental science, neuroscience. And so we think we've really packaged nicely some things that have real meaning and impact to families in a relatively short period of time. I am going to read this entire slide, which is giving voice to the qualitative experience of participants across these 3 programs. So the first bubble, you'll see a participant in the New Parents Connect. So this would be a new parent. And they told us, I appreciate the skills we went over, and that I could directly use them with my baby. They helped me be more aware of my baby's needs. A CCAP participant, so this would be a parent of a preschool age or early school age child, said, it helped me have more practices with my son and gave me ideas for how to go about spending time with him. It taught me to try child-led activities too. So I think these things highlight just the practicality and how easy it is to implement the strategies that we are encouraging throughout these programs. And lastly, this Be Real participant, so likely a college student, wrote, connecting with other students made me feel much less self-conscious about my own efforts. So again, that group kind of community effect. And I feel the practices were genuinely helpful and empowering in my own life. So I'm going to pause here and turn it over to Becca, who's going to put this together for us. How do we address problem 1, burnout, and problem 2, this rise in mental health need within the task sharing model for prevention?
Thank you, Stephanie. It's really good to be here with you all. So we're really a relatively small center here at the University of Washington, and in order to get these programs out in a much broader way, we are implementing what we're calling a task sharing approach. And essentially what this means is we are offering Real Pro to professionals to support their well-being, their resilience, and then providing training and support for them to be able to offer one of these 3 other prevention programs for parents or youth, so that really this can then spread much more quickly. The folks are based in their communities already. The professionals are already working with the youth and the parents, the children and families in their communities. So how do I forward this? Click? No.
Just use the right and left, yeah.
Okay, thank you. So essentially, the task sharing approach is exciting. We've been implementing it for just a little while, and we're pretty excited about what we're seeing already. So essentially, first and foremost, the well-being of the providers themselves is really centered. When we're offering Real Pro, that's what we're focused on. Them, not the fact that later down the line they may integrate this into the work that they're doing. The focus is really on the providers themselves. At the same time, it is providing skill development. So the providers are developing those skills that can be then implemented with the folks that they're working with, be that youth or parents. And this enhances access to prevention, both because these folks are being trained to offer the prevention programs, so those 6-week-long programs, but they also are encouraged to weave some of these practices that they're learning, some of the skills, into the work they're already doing. So both the program as a whole, but also being able to take some of these things and drop them into the work that they're doing in the community already. And when we say providers, we're really talking about providers at all different levels. So this could be folks that are offering after-school programs. This can be home visitors. This can be doulas. So it's really a wide range of folks in primary care settings and school settings and nonprofit organizations. So it's really opened up that allows this work to then be integrated in a lot of different settings, which of course enhances the access to that prevention and increases the acceptability, because it's the people in the community that folks are already working with, already know, already trust. So we wanted just to provide some detail about this sort of 1 year. When we think of this summit and what we were asked to do when we were presenting here is to really provide a picture of, okay, what are you going to do in this coming year, as kind of using this summit as a launch. So for the next year, we're hoping to implement Real Pro with at least 30 to 40 professionals and provide those folks with the facilitation training to be able to implement one of the 3 programs, the parenting program or the program for youth, the Be Real program. So that was what we're hoping for this year, but the fact is we've actually been implementing this for a little while now, the task sharing approach. As Stephanie mentioned, we've been doing Real Pro and the other programs for longer, but we really wanted to gather the evidence. We are, after all, a research center here at the university, so we were gathering the evidence for the programs, and now we're really trying to roll them out, scale them up. So we've already been implementing these programs with community partners that we're so grateful for in pretty diverse settings. So in early learning programs with, for example, perinatal settings, Open Arms, Perinatal Services is a partner of ours. In primary care settings, some folks here today have been through Real Pro, and we really are excited that we've done it kind of at all of these different levels, so we know that it can work in all of these different places that we're talking about. And the communities that have been represented in the program are also really, really diverse. So the folks that are coming in and then offering the program back out to their communities include programs that are specifically for BIPOC communities, for immigrant and refugee communities. We just recently were awarded a small grant to implement the program from the Latino Center for Health here to implement the New Parents Connect program in Spanish-speaking communities. And then we've also worked with folks post-incarceration and offered the program to folks who have lived experience, who are then turning around and as peers offering this program to folks that are more recently coming out of incarceration. So right now, as far as translation goes, the New Parents Connect program and the CCAP program are available in both English and Spanish. We have a lot of interest in Mandarin as well, and we keep having folks ask us to make it available in Mandarin, but we're not there yet, so that is a need. And the Be Real program, the program for youth, we also are interested in having that work done in Spanish as well, but that's something that is to come yet. But right now we have it available, New Parents Connect and CCAP in Spanish. And this work thus far, we've been fortunate to be supported by the Moritz Family Foundation and the Balmer Fund to be doing the work that we've been able to do up to this point. So, the gaps, kind of what do we need now? So we have quite a few connections here in the King County area, and we have some connections outside of King County and the rest of the state, but we're really hoping through presenting here we can make more of those connections outside of the King County area. And of course, this has already been talked about quite a few times today in other presentations, talking about the funding that's needed for scaling this up, particularly for the organizations that want to offer these programs in an ongoing way. There needs to be some sort of sustainable reimbursement, sustainable funding streams to support this type of prevention work in the community. So, our vision overall is to have a robust and sustainable statewide training program for Real Pro for professionals with that facilitation training, and then for those organizations to implement the prevention programs with parents and youth, which will lead to those community effects of increased resilience and skills for the providers, as well as the increased well-being for parents and youth. So this comes to the end, how you can get involved. So essentially, we're really looking for community partners. So if you represent an organization or a statewide network, organizations that are serving these populations and are interested in Real Pro training for the professionals themselves and are interested in being trained in one of the programs, please do reach out to us. And then both funding to support the work we have currently going and lobbying, legislative drafting, that kind of work to get this type of prevention program covered by more sustainable funding reimbursement model. Okay, I think we can open it up for questions now.
Now we're standing between people and the
end of the day. We were joking around before we came up that we should just say, you know, the program's really cool. If you're interested, just reach out to us, and then you can go home. It's been a long day. I do also, maybe just before we go, if there aren't any questions, I want to introduce Shayla Collins and Troy Landrum over there. Can you two stand up for a minute? So these are our lovely colleagues that are Real Pro trainers, along with myself. We and There are some others, but that provide the Real Pro training to professionals, and I'm just so fortunate to work with them so they can also answer questions about Real Pro if you don't have them now. Yeah, okay, thank you all.